In an interview with Jake Tapper on CNN's State of the Union, Bernie Sanders talked about the upcoming single-payer healthcare bill that he will be introducing pretty soon. Now, during this interview, what Bernie Sanders wanted to emphasize was the importance of this bill, what it would do, and how it would benefit the American people. So this is what he had to say specifically.
Are you going to introduce single-payer?
Absolutely. Of course we are. We're just, we're tweaking the final points of the bill. And we're figuring out how we can mount a national campaign to bring people together. Here's where we are, Jake, and it's important for Americans to understand this. We are the only major country on earth, the only one, not to guarantee health care to all people. The result is 28 million people who are uninsured, millions of people who are paying deductibles and co-payments that are far too high. And if the Republicans had gotten their way, there would have been another 30 or 32 million people thrown off of health insurance. That is crazy. What we should do is move in the direction of every other major country, guarantee health care to all people as a right, not a privilege. Second thing you got to do is ask ourselves a very simple question, which my Republican friends and the president does not. Why is it that in America, per capita, we are spending far, far more on health care than do the people of any other country? Why are we paying by far the highest prices in the world for prescription drugs compared to people all over the world? Those are the issues we've got to tackle. And I think the answer is pretty obvious. What we have now is a healthcare system not designed to guarantee healthcare to all of our people in a cost-effective way. What we have is a dysfunctional, complicated healthcare system designed to make as much profit as possible for insurance companies and drug companies.
So everything that Bernie Sanders said there was reasonable. So it's obviously the case that we spend more per capita on healthcare than other countries. We pay more for prescription drugs, and we don't get better results. So of course, single payer is the objectively best option, both in terms of better healthcare costs and results. And rather than educating his viewers about the benefits of single payer and talking about Canada and the UK, Jake Tapper decided to muddy the waters about single payer healthcare and actually challenge Bernie Sanders on this issue.
Let's talk about single payer, because it was attempted in your home state of Vermont, and it didn't work because they couldn't get the funding because it would be too expensive, the Democratic governor said. And then recently it failed in California as well. Democrats, again, not able to come up with a way to pay for it. These are cobalt blue states, Vermont and California, where people wanted single payer, and there were problems because it would cost too much. How do you make it national if you can't even get it in Vermont or California?
No. Let's be careful about this.
All right.
A single-payer healthcare system, in my view, and according to studies that I have seen, would save the average family significant sums of money. And what Republicans sometimes do is confuse the issue. And they say, well, you're going to pay more in taxes. What they forget to tell you is that if you are a family of four, now paying $15,000 or $20,000 a year in private health insurance, you're not going to be paying that at all. Once again, if you look at Canada's single-payer healthcare system, per capita, their costs are far, far less than the United States. If you look at the UK, if you look at countries around the world, all of which have different approaches to a national healthcare system, in every instance, they are spending substantially less per capita than we spend in the United States, substantially less for prescription drugs. The problem with our system is it is so complicated for the consumer, for the doctors, is that a hospital, for example, might be dealing with 15, 20, 30 different insurance policies. It takes an enormous amount of time, energy, and expense to figure out that you have a $5,000 deductible, you have a $10,000 deductible. The goal simply is to say that every person in this country, through a single-payer system, is entitled to a comprehensive health care approach, and that will save substantial sums of money in administrative costs, substantial sums of money in lower prescription drug costs, substantial sums of money in doing away with the profiteering of the drug companies. By the way, the 5 top drug companies in 2015 made $50 billion in profit. These CEOs in the healthcare industry make enormous salaries.
Right.
We should join the rest of the world begin that discussion immediately, and I will be introducing legislation to do just that.
So first of all, I'll just say that I don't have a problem with Jake Tapper challenging Bernie Sanders or even challenging the idea of single payer, even though it's a fact that it's the best option, objectively speaking. But the problem is that he's being incredibly disingenuous here because he's conflating the inability of single payer to be passed in states like Vermont and California with single payer as policy, generally speaking. Just because it hasn't passed doesn't mean it's bad policy. You can't say that it's been tried but failed. The law hasn't even been put into place in Vermont and California. And whether or not it's good policy is a different subject than its ability to muster political support. But still, it's reported by Jake Tapper here as if single payer passed but was ultimately unsuccessful policy, when that's not the case at all. It never passed, so we don't know if it would have worked in Vermont or California. Now, he's not saying this directly, but he's implying that because single payer can't pass in, quote, cobalt blue states like California and Vermont, that it's not good policy. This is the underlying implication. Now, the assumption here is that it failed to pass in these states because these bills just didn't include funding mechanisms. But the problem with this argument is that there are funding mechanisms, but corporate Democrats don't want to fund it because they're taking money from health insurance companies. So with respect to California, the bill in its current form did lack a funding mechanism because proponents of the bill didn't agree on which funding mechanism they wanted to pursue. However, there were multiple methods that were actually being floated that could have funded the bill entirely. But rather than allowing any type of debate to take place, Speaker Anthony Rendon, who is a shill for the health insurance industry, decided to shelve the bill entirely. He decided to shut down debate. So because corporate Democrats don't want to fund it doesn't mean that you can't fund it. As Dina Turner stated, if we can go to the moon, we can get Medicare for all. And certainly other countries have worked it out. They figured out a way to fund it. And certainly we can figure out a way to fund wars. I mean, we put wars on the credit card. We get pretty creative when it comes to killing people in Middle East and North African countries. So I'm pretty sure that we can come up with some way to fund Medicare for all. But understand that Jake Tapper here, again, he's being disingenuous because he wants you to think that because corporate Democrats, they don't want to fund it, that must mean that there's no way to fund it. It's impossible. That's not true. That's a lie. So the takeaway is that if other countries can do it, so can we. But Jake Tapper here is borrowing this line that we can't fund it straight from health insurance companies, many of which probably advertise on CNN, mind you, in order to make you think that it's impossible when it's not impossible. Now, another thing I want to get to here in this clip, Bernie Sanders said that according to the studies that he's seen, single payer would save average Americans money, but, quote, what Republicans sometimes do is confuse the issue and say that you're going to pay more in taxes, but what they forget to tell you is if you're a family of four now paying $15,000 or $20,000 a year in private insurance, you're not going to be paying that at all. So this is a really important point to make here, but I honestly think that Bernie Sanders is being too kind in stating that only Republicans make this assertion because the same media network that he's on has also muddied the waters with respect to this very subject in terms of how much taxes will go up and how much money taxpayers will ultimately save as a result of single payer. Now, I'm going to play a clip from you back from a town hall with Bernie Sanders back in January of 2016, where he talked about single payer, and I want to then show you how the media reported on what he said.
But just to be clear, you are going to raise taxes to do this.
Yes, we will raise taxes. Yes, we will. But also let us be clear, Chris, because there's a little bit of disingenuity out there. We may raise taxes, but we are also going to eliminate private health insurance premiums for individuals and for businesses.
All right, next question.
Now, what he said there was clear. You'll be paying more for taxes. Yes, that is the case. However, in exchange, you'll be saving money, even though you'll be paying higher taxes because you'll no longer have to pay your monthly insurance premiums. Now, can you guess which portion the so-called liberal media decided to report on with respect to that quote? So let's take a look. MSNBC's headline read, Bernie Sanders, we will raise taxes. Yes, we will. The Hill read, we will raise taxes, yes we will. Washington Examiner said the same thing, we will raise taxes, yes we will. Mike.com, the same thing, we will raise taxes, yes we will. And when it comes to WorldNet Daily, care to take a guess? Bernie Sanders, we will raise taxes. Yes, we will. And the same is true for the Fiscal Times, Breitbart, Yahoo News, the Daily Caller, and so on. But since CNN actually had Bernie Sanders on, and they had the full context, of course, they would report on what Bernie Sanders said in a less misleading way, right? Well, not actually. So their headline also focused exclusively on taxes as well, saying Sanders breaks with campaign tradition, calling for tax cuts, and they then go on to talk about how unprecedented it is for a Democratic candidate to do that. And the only outlet that really had a semi-accurate headline was from AOL, which, yes, surprisingly, they do still exist, and their headline stated, "We will raise taxes, but people will save money." So with the exception of AOL, really, there's no room for nuance whatsoever. Taxes is a bad word. If you say it, we're going to dismiss everything you have to say and focus exclusively on that. So understand why people typically dislike taxes. It's because you don't like that money is coming out of your paychecks. You think either that you should be paying less money or that the rich should be paying more. So you want more money in your pocket. That's why you dislike taxes. But even though what Bernie Sanders is proposing here would facilitate working class Americans having more money in their pockets because they wouldn't have to pay for monthly health insurance premiums, well, he said taxes, and that's a bad word. So again, there's absolutely no room for nuance, and this example is one of the many ways that the media tries to spread misinformation and muddy the waters with respect to not just single payer, but many issues, and Jake Tapper did just that. He tried to mislead people, and he put forward this disingenuous argument about single payer. Now, of course, Bernie Sanders, what he did was he made a really strong pitch for single payer. I think that everything he said to Jake Tapper was what I would have said. So of course, Jake Tapper, being the more reasonable person on CNN, he actually internalized what Bernie Sanders said and decided to accept what Bernie Sanders said, right? No, that's not what he did at all. In fact, he decided to challenge Bernie Sanders again and posed him the same exact question again.
Well, why couldn't this happen in Vermont then? I mean, what's the issue in Vermont? Vermont would be would seem to be a perfect test case.
Well, politically, this is difficult. And by the way, in California, the debate is not over. It passed, I think, the Senate. It's now gone to the House, and that debate will continue. Look, taking on the insurance companies and the drug companies, taking on Wall Street, taking on a lot of very powerful forces that make billions of dollars a year from the current healthcare system is not going to be easy. And it's not going to take place until millions of people get involved in this struggle and appreciate the fact that whether you're rich or whether you're poor, healthcare is a right. The idea that the Republicans wanted to throw 32 million people off of health insurance, cut Medicaid by $800 billion, raise premiums for older workers, defund Planned Parenthood, make it almost impossible for people to have who have pre-existing conditions get the health care they need, that is abominable. That is moving in exactly the wrong direction. So we need a serious discussion about a serious issue, and I believe at the end of the day, the American people will conclude that Medicare for all, Medicare is working now for people 65 or older. Let's expand it to everyone.
So again, Bernie Sanders was spot on, and Jake Tapper here, he's being very disingenuous. He's doing the agenda of the network, specifically the advertisers of the network, and he doesn't want single payer because that would affect the bottom line, it'd affect more than the bottom line of health insurance companies. This threatens them existentially, right? So he doesn't want single payer, and this is one of the ways that the media tries to mislead the public about single payer, but you need to be cognizant of their tactics and how misleading they are. But again, we shouldn't be surprised. Yes, it is the case that Jake Tapper is probably one of the better anchors on CNN, but at the end of the day, a propaganda outlet is going to do what it does best: spread propaganda and mislead the American people.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.